Hello, my name is Dr. Stanley Lang. Welcome to this broadcast. I like to talk about things from a whole health perspective, hence the word whole health doc. And today I'd like to talk about your GI tract and having a healthy GI tract, because I saw an unusual number of patients today that really required sort of a deep dive into what was critical for them getting well, which was to restore their GI tract. So I'm not going to go into that deep dive, but I just want to go into kind of a review of some of the critical points to think about if you're wanting to make sure that you're addressing the most important issues related to your GI health, because your GI health is really the key to your health. And so GI stands for gastrointestinal. And the reason that the GI health is critical to your health is because of the biome, which is a word that describes the community of microorganisms that lives in your GI tract. So if your biome is happy, your GI tract functions much better, and your immune system functions much better. Now, the reason for this is because there's an intimate communication between this community of organisms, the biome, and the cells that line your GI tract. So there are two different basic concepts to keep in mind, I think, every time you eat, and certainly every day when you want to focus on having it as a goal to have a healthy biome. And the first is what you need to avoid to have a healthy biome. And the main thing, in my experience, that people need to avoid is glyphosate. Glyphosate is the main ingredient in a common pesticide, a common herbicide called Roundup, and it's sprayed on many of the crops. And much of the food that's sold in our stores is contaminated with glyphosate. Most of the grains are contaminated. And the problem is you can't go into any store right now and know what is glyphosate free and what is not glyphosate free. So the concept behind this is that you need to eat organic, which by definition also means that you're going to eat non-GMO. GMO stands for genetically modified organisms. And so because GMO foods are sprayed with lots of glyphosate, typically, you need to eat non-GMO, and by aiming for organic and making sure that it's non-GMO, which is another way of making sure that it's organic, you will limit the amount of glyphosate. Now, the reason you can't eliminate glyphosate is because, unfortunately, our water supply is contaminated with it. So most of the groundwater in the United States has glyphosate in it. The rainwater that comes down, even on your organic crops in your backyard garden, has glyphosate in it. So we can't completely eliminate it, but we want to try to limit it. Now, why do we want to do that? Well, it does several bad things. I'm just going to touch on three of them. First of all, it's a very potent antibiotic. So it kills off many good bacteria, and it distorts the balance of the different species that live in your GI tract, because it gives a competitive advantage to some species and a disadvantage to others. And so there's over 1,500 bacterial species alone in your GI tract. They're all important, and what's important is that they have good balance between the different species, and glyphosate seriously disrupts that. The second thing that it does is that it destroys the communication network between the bacteria. And that communication network is critical for the bacteria then communicating to your GI tract. So they're supposed to be talking to your GI tract about the state of their health, and they're sensing in part what you need to be consuming. And so that signal between the bacteria and the bacteria communicating to the GI tract is disrupted by glyphosate. The third major issue is that glyphosate seriously damages the connection between the cells that line your GI tract. It essentially disrupts their ability to maintain a good seal to keep the bad stuff in. And so you end up with what is called leaky gut because of glyphosate. It's much more complicated than that, but you don't need to know anything more than that to know that glyphosate is contributing to this leaky gut phenomenon. Everybody is different in how much they can tolerate, but you can't measure ahead of time what you can tolerate, but I can guarantee that it's having some negative effect in you right now. The question is how much and how long is it going to be before you get sick as a result of it. So the idea here, the first principle then of having a healthy biome is that you're eating in a way that limits glyphosate and other chemical toxins, other herbicides, and then a whole class of chemicals called pesticides, and a lot of other chemicals that are in the environment. The more you limit them, the less damage to your biome. And the healthier your biome, the healthier you will be. Now, the second principle is then what do you put into your diet in particular to help restore the biome? There's a few things that we can focus on. First is fermented or cultured foods. So fermenting or cultured foods sounds kind of gross to some people if you haven't studied this before. But basically, this fermentation process for food storage and for food maintenance is as old as human history. And fermentation creates many, many different good bacteria species that we can consume, and they can survive passage through the stomach and live in our GI tract and help to restore the GI tract. There's many, many different species that are present in fermented foods that you can't get in any kind of a probiotic capsule, no matter how fancy and expensive it is. So I recommend 4 different major fermented food groups to my patients when I'm trying to help them to restore their GI tract. The first is organic apple cider vinegar. The second is kefir, which is fermented milk. The third is fermented vegetables, such as sauerkraut. And then the fourth is kombucha, which is fermented tea. Now, yogurt is sometimes thrown in. It's complementary to the kefir because although they're both fermented dairy products, they're fermented at different temperatures. So the yogurt has what are called thermophilic bacteria. They like heat, and so they're slightly different in terms of the bacterial presence that you're putting into your GI tract. But if you're going to choose between yogurt and kefir, you would want to choose kefir. It's far better as a probiotic strategy than yogurt. In either case, you want to be consuming organic versions of either one of those. And if it's yogurt, it should be whole milk, not the low-fat so-called Greek yogurts. And the other thing that I recommend putting into the system is what we call humic acid. Now, humic acid is a nutrient that should be in the foods we're consuming because bacteria in the ground should be creating humic acids that the plants then absorb. But unfortunately, the same chemicals that have destroyed our GI tract have destroyed the biome of the GI tract, have also destroyed the biome in the soil. And so the soil no longer gives us adequate amounts of humic acid. And humic acid plays a couple of major roles. Number one, it helps to improve the communication between the bacteria that live in your gut. It's part of their communication network. And when you don't have the humic acids in there, they can't talk, the bacteria can't talk to each other well. Second of all, humic acid helps to grab onto glyphosate and make it less likely to be absorbed by your GI tract. So if you're intentionally trying to decrease the amount of glyphosate in your diet, some of it's going to sneak through because of the aforementioned contamination of our water supplies, and so it's in the rainwater, so some's going to get through even if you're eating organic. So if you've limited it a lot and you're taking the humic acid, then that will help to capture some of this glyphosate, or maybe much of it. So these are some simple things that you can do every day to help restore your biome, which is the foundation of you being as healthy as possible. And this was critical to several of the patients that I saw today. It's always critical to all of my patients, but it was critical to the discussion that we had in the exam room for a variety of different conditions, but they all had in common the need to get the biome right if they were going to get better. So I want to encourage you to really pay a lot of attention to that. If you want more help on doing that, you can have access for 7 days free to look at the course that addresses all this stuff and includes information on how to do what I've just been talking about, as well as many other things that will help you to be healthy, because it addresses physical, emotional, and spiritual elements of living with less stress or no stress, or a lot less stress, which requires paying attention to all of these issues. So if you want that help, click on the link for the free information. And if you feel like you're fully fortified with the information you need, then glad to have helped. I wish you well. God bless, and have a great day.